in representation of Lorraine Sandoval, Matt Miller from Miller Healer, a healthy solution and flawless creations. It is my pleasure to introduce to you Dr. Allan Frankel out of Greenbridge Medical in Santa Monica, specializing in all natural treatment of multiple different diagnoses as well as epilepsy and seizures.
As you just heard, my name's Allan Frankel. I went to medical school at UCLA, finished in 1976, did my internship residency there, and then went into a private. And then some things happened in my life, some things happened in friends' lives. I started looking at cannabis, which actually I'd never used until I was 49 years old, which was 18 years ago. And once I went through an illness that was helped by cannabis, I became much more interested, and about 14 years ago started my cannabis practice, Greenbridge Medical in Santa Monica. The first few years were really, to say they were casual, at the very least they were casual, and within a couple, 3 years I was bored with it, not because I was opposed to people using cannabis for casual reasons. I'm from the 60s. But it wasn't medically very interesting, and using smokable products for people who enjoy smokable products and get benefit from it or enjoy it, I'm all for that. I have no issue. It's a pretty safe thing to be doing. But if we were going to ever get cannabis to the point where it would be what I like to call a normalized medicine, that it looks, feels, is dosed, just like any other medicine you would get by a doctor, that had to all change. So we had to start learning about extractions. We had to start learning about CBD, which maybe started 9-10 years ago, was the very, very, very first strain the first strains we found, at least in California, if you think of it as a scale, where one end is pretty much all CBD and the other end is all THC, the most common strains in history fall into the middle, 1 to 1, 2 to 1s, 1 to 2s. So we found those first, and then fortunately a group in Spain found a strain that maybe many of you have heard of, ACDC, and they were very generous to share it in Northern and Southern California, and then high ratio CBD medicines took off. And then the crossings with them, and if you guys were a family, or with, let's say, a child with a seizure disorder coming into my office now, what would happen? First of all, I would be playing with the child in the waiting room for a few minutes, because then they don't think of it as a doctor's office, and they come back to the office and play with other toys. To date, I've seen 275 seizure kids and about 300 kids with autistic spectrum, about 50 of those having seizures as well. And to start with, we were starting with whole plant CBD, and I'm sure I'll mention it a couple times. How long do I have? 10 to 15 minutes, okay.
20, sorry,
20? Great. So when the autistic spectrum kids came in, we realized very quickly they needed THC, but they were also seizing, and 7 years or so ago, we didn't think THC was the right thing to be using for these kids. Well, that's changed dramatically. All of the kids I have, virtually all of them now, are on at least some THC. We pretty much start, if your child came in with autism, if your child came in with seizures, if they came in with seizures and autism, we would still start with CBD. So the first question to talk about is, where does the CBD come from? And I can tell you, after doing this in my 13th year full-time cannabis practice, I honestly don't know what's in most of the products out there. And what's worse, if you even have them tested, that doesn't guarantee anything, because people are, instead of using, if you read anything I've written, anything I've done, it's always been about the whole plant. And that means taking the cannabis plant, or we can talk about buds. The leaves are good for nutrition, but they have so little and they add such bad taste to the extract. We do everything from, all the extracts from buds. And the seizure kids, a number of them, probably about half of them that end up respond to just CBD, whole plant CBD, in doses ranges from 50 to 100 milligrams per day, in divided doses. The hemp CBD, hemp is going through a lot of changes, and they're hundreds of thousands of years ago, maybe a couple 100,000 years ago, there was a plant that was before hemp and before cannabis. It was just something in between that's in the genus of Cannabis sativa. But now there are a lot of terms that are used that confuse people. And at the end of the day, the most important thing to remember about the medicine is that it should smell like cannabis. So when you get a bottle or a capsule, open it, it should smell like cannabis. If it smells more like hay or cherry, to me, it's either not helping or for sure it's confusing the parent and the child as to how the value of the medicine is. THC is not the kid's enemy. THC, kids do very well with THC, and I have very, very little hesitation in adding it, immediately. Now, if it's a child, even if it's a child with seizures and maybe is a little spectrum-y, or for sure a kid on the spectrum that has seizures, and those are pretty commonly found together. So if we couldn't use THC, or THC made the seizures worse, we'd have a lot of problems treating the autistic children, because for the violence and acting out and biting, CBD, generally in my experience, is not a big help. It helps with a lot of other things, including brain development. Even with the seizure kids, although they are otherwise generally normal, if a kid is having 20, 30, 200 seizures a day, how are they having any memory? How are they putting anything into the brain and having it stick? So when we treat the children, we certainly see a reduction, at least in 2/3 of the kids, a significant reduction in seizures. And I would say overall, out of the 250 kids that we've treated, about 150 are controlled to less than 1 seizure per week. So it's not always perfect, but that's also, it depends what's else going on with the child, whether you go for perfect or not. Sometimes you need to go for perfection, and then dosing needs to be changed. It's not always raising CBD anymore. In the next year, you guys are going to be seeing and hearing about a lot of new molecules, oils that are now available because new strains are being made and new strains are being found. As far as, let's talk about CBD first. So generally, if it's a seizure kid coming in, let's say on your typical, they're usually 2 seizure meds that they're on, which is their biggest problem ordinarily. And one of the first questions comes up is, we want to stop the meds and then start CBD. Well, that's generally not a good way to do it, I don't think. What we try to do is treat the child with cannabinoid medicine, starting with CBD and then adding in more that I'll talk about in a minute. And adding THC if they're already having aggressive outbreaks. And if they're not, we'll start with CBD. We'll go up to 50, 60, 70 milligrams of whole plant. Now, to how many people in the room does 50 milligrams a day seem like a tiny amount? How many does it seem like a huge amount? Okay. Is that because you guys that say it's a tiny amount or you have been using CBD? Right. So how many people in this room actually have used CBD for their kids? Any other cannabinoids, THCA?
All above.
All the above? CBG, anybody using CBG yet? What's been your experience with THCA? Yeah, THCA is remarkable. It's remarkable for seizures, and I'm starting to almost go to a 1-to-1 balance. And what I think the future of these medicines are going to be, I mean, if let's say you had a child where you could give them 4 pharmaceutical seizure meds, but if you gave them those 4 meds, there's no question they would have, or very little question they'd have no seizures left because you're treating them. It's like cancer patients. If you were to give them 15 chemotherapy medications, for sure their cancer would go away, but they wouldn't survive because of the toxicity. With cannabis, we're kind of thinking the same thing, except we don't have any more toxicity. CBD works, for sure, for seizures. I mean, that's not new information. We've known that for 30 years. THCA works a lot better than people realize, but it's going to be added more and more. CBG, and particularly as it becomes more available, will be added. THC, I think I mentioned. And then there are the varin molecules, and you'll be hearing a lot more this next year for seizures about THCV. If I had a slideshow, I would show you that the only difference structurally between THC and THCV are two little molecules at the end of the tail. It looks almost identical. But one of the points, the reason I'm bringing that up is you can have a tiny 1 or 2 atom change in one of these cannabinoids and it has completely opposite effects. That scares me when it comes to people in the manufacturing business of making new molecules, I mean pharmaceutical companies, in making new molecules that we really don't know how they're going to work. I mean, there have been 2 nightmares of, they're actually not cannabinoids, but they're medications that interact with our endocannabinoid system. We have a system inside of us that, like our nervous system, our vascular system, our endocrine system, all these systems, we have an endocannabinoid system that's been around for 1 billion years. 1 billion years. Cannabis has been around probably about 100,000 years. So they didn't evolve together. They started separately, and then at some point, 100,000, 150,000 years ago, they came together, and man, just like he did, or she did, with everything else, they picked the ones that they liked. And so there was ranges of only CBD on one end, only THC on the other, and everything in between. But everything was in low dose. The average strain had maybe 2% THC, 1.5% CBD, 1% THCV, and CBDV. So the CBDV and THCV are the varin molecules that have been extremely rare to find, and I think there's some manufacturers that are manufacturing it, but then it's not whole plant, and it's not what my heart loves. But THCV, probably with a lower THC ratio, is going to be a huge, huge deal with seizures. And I think the way we're going to be handling these kids, and that, by the way, it's not just kids anymore. I'm starting to see more and more adults, which confirms, with regard to dosing, there are a lot of people who feel that you dose by weight. I have just never found that to be useful. And everybody that I talk to that doses X milligrams per kilogram, they don't start there anyway. They start at 10 or 20 milligrams and slowly increase. So I'm not convinced that there is a dosing that you can pick per kilogram. The only way we're going to know is if we get laboratories set up where we can measure the plasma levels of these cannabinoids, and maybe there is a therapeutic level for CBD. There are therapeutic levels for every other seizure med, so why shouldn't there be one for this? And I'm sure a few years from now we'll be talking about this meeting and thinking we couldn't do it then, but we will be doing it in a few years. Because from a cannabis physician's perspective, the biggest issue I have is, let's say you bring in a child and we start at 30 or 40 milligrams, 50 milligrams of whole plant CBD, and slowly go up and get close to 100 milligrams. In my experience, most kids are going to respond by there. And if they're taking hundreds of milligrams, I would say that either they're going to be very drugged, or it's hemp isolate or distillate. Just a moment on distillates and isolates. An isolate means it's 100, basically 100% CBD. A distillate's like 97% CBD. But the goal there is to have pure medicine. And pure medicine, whether pure is good or not, depends upon what you mean by pure. If you're saying it should be pure and free of toxins, pesticides, bacteria, fungi, yeah, of course, we don't want it to be contaminated. But pure meaning we've taken this plant that's been evolving for 100,000 years, and evolution has put 800, 700 different molecules in it, and we pick that one. That's a model that we've been taught by pharma, not a model that man evolved with. And there's absolutely no question, at least in my mind, and certainly anybody that has ever treated patients with whole plant cannabis, that there's a huge difference between whole plant and single molecule. Just to confuse things, there's that hemp plant of the past that was also the cannabis plant of the past, and then they split. Well, now they're coming back together, and there's other versions of hemp that I'm calling, for no better reason, I can't think of a better name, hemp version 2. And basically, we're reverse engineering it over the last tens of thousands of years, and then if you take a hemp plant and cross it with a cannabis plant and do it enough and do it properly and study all the progeny of the plants, you can then have a plant that's cannabis. There's no difference between it, just as there was no difference between it 100,000 years ago. So hemp will have an exception, and there's going to have to be some way to explain to the consumers the difference between basically single molecule CBD hemp and hemp version 2, but basically it's going to be a cheaper to grow cannabis at the end of the day. But you'll be seeing that. So how many people in here have a kid or family member that has seizures? Okay, and how many already on CBD? Okay, of those, how many got CBD from Erewhon or Whole Foods or some other great medical store? Yeah, I don't think those stores are selling the best of the products. And I would encourage you to get at least one bottle of a well-made whole plant CBD extract and try the difference, smell the difference. I mean, if you have 2 bottles, yeah.
Sorry. Charlotte's Web, I keep on seeing it's the best one for epilepsy. Is that very true?
I don't think so. I mean, this is what I think happened. The people in Colorado, we were already treating kids before the whole thing with Sanjay Gupta came up. So we were upset they got all the credit. But at that point, Charlotte's Web was a version of AC/DC. It wasn't some new strain that was developed in Colorado, but it was a very good strain of CBD. Ultimately became cheaper to use hemp, and they switched. As far as I know, and I would love to have bottles that I could order and prove that they went from whole plant cannabis to hemp, but I'm virtually certain. I mean, I've had dozens of patients that have gotten that and other hemp, and it says now hemp on it, but then you wonder, well, they're saying hemp because they could get away with selling it, but at the end of the day, you open that up, smell it. It doesn't.
It just has a smell to it.
It needs to smell like cannabis. I mean, if you had a lemon and you a lemon paste and you open it up and it smelled like cucumber, no matter what they said, you wouldn't be comfortable with it.
And I haven't really gotten anything out of it. I still have seizures.
It doesn't work.
It's not doing it.
And there's another problem with it, and this came up. This is part of a discussion with Epidiolex, the new GW pharma drug, because there you need to use it much. If you're using single molecule, you can't use 60 milligrams, 50 milligrams and ever have it work. You need hundreds of milligrams. And when you get to hundreds of milligrams of CBD, that's when you start getting into drug interactions, hepatic P450 problems, and just toxicity of CBD, because it's meant to be with the other plants.
I was wondering, or is there any CBD one that you recommend?
Well, not in this environment, because believe it or not, I mean, there's a lot of believe it or not things, but it's illegal for me to give you advice. Now, in person, I might do something differently. If you showed me your ID and... Yeah.
Is there any cannabinoid, if any, that would be safe to take during pregnancy or breastfeeding?
All right, well, this is the first time in public that I'm actually going to state this. Just as we have an endocannabinoid system, when you're breastfeeding, breast milk is full of cannabinoids. There are hundreds and hundreds of cannabinoids in breast milk. That's what makes the kid hungry. If we had not gone through the last 80 years of prohibition, and somebody said, this tomato plant, this other vegetable plant is going to be toxic, nobody would believe it. I don't believe it's harmful. I just don't believe it. Now, am I going to be irresponsible in it? No. And if there's no really good reason to do it, I would say I wouldn't do it. But if there's a reasonable reason, for example, hyperemesis gravidarum, excessive nausea and vomiting, that's a situation where absolutely using whichever type of cannabis is way safer than treating with nothing or using antiemetics that are pharmaceutical when you're pregnant. So probably, well, as a man, if I were pregnant, for sure I'd be using cannabis, I know. Otherwise I wouldn't be able to tolerate it.
Recommend any strain over another, like THC over CBD, or is it all the same?
CBD and THC?
Yeah, like versus like.
They're all very different. Very, very different. I mean, of the people in this room that are using CBD, how many of you actually saw a doctor that had a license and a career? And one or two people. And again, how many people of you are using CBD? There was more than here. So in other words, 95% of the people using CBD, and I'm not saying that everybody needs to talk to a doctor, but it's not the end of the world. I mean, if you had anything else wrong with you, depending, I mean, I left my Western medicine practice that was, frou-frou internal medicine on Wilshire Boulevard, but now it's frou-frou on Wilshire Boulevard and cannabis, so I guess frou-frou is important. Oh, yeah.
I have a question. So when you purchase CBD oil and you're doing trying it, like with any drug, you don't want to take too much, but you never have the right. Well, usually someone will say, well, don't take too much, just try.
But what's too much?
Well, and so that's my question, what's too much? And so what if you're taking another medication too? So you worry about the interactions of this medication, that medication, how it's going to affect you too, and how it's going to affect you. And so you actually have to have, and this is kind of a question I'm asking you and something I'm noticing, you have to have somebody else kind of monitor you when you're starting something, because how do you know how it's affecting you unless someone's watching you take it? Or not watching you, but you're starting
Following.
something new. How do you know how it's affecting you if you don't have someone who's close to you who's monitoring you? So
Well, let's say you came into my office and you had a child with a seizure. We would talk about the stuff we talked about here. We would talk about the options of starting. We'd talk about your own feelings, your family's feelings, although people are pretty open-minded now. And most of the kids I see are already on 2 meds, so the chance of a third med working for them is 10%, and they're already toxic from the 2 meds that they're on. We would talk about dosing. We would start on a dose, and depending upon, because you know your child way better than I, whether it's going to be sprays, whether it's going to be droppers, whether it's going to be a syringe, whether it's
adult, an adult.
adult, then we use capsules. Yeah. But I would still start with CBD. In the adults, I'm actually using lower doses. It's interesting, and I'm partly because it came with capsules and it was convenient. And that, maybe I shouldn't say that, but it seemed a simple way to do it for the adult patients. And the kids, none of them can swallow capsules. But 45 to 60 milligrams of whole plant CBD with the right product is often fine for the adults with seizures. And adding THC, adding THCA, I think ultimately we'll be combining all of these in. And then it's going to be something's going to have to change, because once if you're adding THC, THCA, CBG, all these other molecules in low doses to make one super duper anti-seizure med, it's going to be very hard to do that not impossible, with the hemp to come, that will be possible. With what's available now, it's impossible to do. So of course I have a bias. I think physicians that have been doing it for 10, 12 years have learned something, hopefully. The problem is doctors are too scared to do this. Now, I lost my license for 5 years. I went to court and got it back. The reason they took my license away was because they said I was too happy while they were punishing me, and that meant I was psychotic. And you can look it up. It gets funnier every year. But,
Do you have age limit that you treat?
my youngest patient's 3 months. So I would say no.
And then if
Oldest? I think about 70-year-old adult.
My dad started, he's 94.
Pardon me?
My dad started, he's 94.
Well, remember, CBD, there's a lot of other reasons to take CBD. I mean, it helps prevent Alzheimer's disease, it's cardioprotective, it's neuroprotective.
so my daughter's 4 months. Let's say I got her and she's on 2 medications. Is your goal?
Capranonfi or?
Is your goal to just have her on CBD in the end, or is it to work with the medication?
The goal is always to try get them off the seizure meds. And that's a time, let's say your child is on 60 milligrams of whole plant CBD, doing well, but it's also on Onfi, Kepro, whatever. We pick one first, and often during the taper phase, we didn't know enough a year ago to do this, but now we'll add in THCA, soon we'll be adding in THCV, just to go through the tapering phase, and then start lowering those, giving it another 6 months, and then try to get off the second medicine.